So whenever we think of BRCA, BRCA mutation, most people 100% of the time go to breast cancer. It was originally researched and found in breast cancer patients. Yes, absolutely. It is still a breast cancer genetic marker, but it is also found in lots of other cancers. We find it in ovarian cancer, we find it in prostate cancer, we find it in colon cancer. So not only is it in breast, but it is in the other cancers. And I want to look at this study from 2022. BRCA mutations in ovarian and prostate. So obviously only females have ovaries and obviously only males have prostate. However, this is a female and a male that can get cancers associated with the BRCA mutation. So I want to demystify the fact that BRCA is only for breast. And if you have a family line that might have had breast or prostate, you might want to get other family members checked for BRCA mutations. Not just the females, but also the males, because males can get the prostate cancer, males can also get pancreatic cancer, males can also get colorectal cancer that has BRCA mutations. So everyone in the family, if you want to cover your bases, everyone in the family of a family that is known with BRCA mutations should be tested and see what they have. Now, just because you have the BRCA mutation does not mean that you're going to get cancer. It just means that you have a higher risk of getting that cancer. So you might want to do things a little bit differently in your life. You might want to cut down on alcohol. You might want to, not smoke, and you might want to, kind of mind your bedtime and kind of live a healthier lifestyle that limits your risk. I always say whenever people have genetic risks, I say it's like getting into a car and a car accident. If you never get into a car, you'll never get into a car accident because you're not in that situation. If you don't have the genetic risk, you're not going to have a cancer that's genetically related to that genetic receptor. However, if you do get into a car, you have the risk of getting into a car accident. But every time you get into your car, you don't have a car accident. So just because you have the BRCA mutation does not mean you're going to get a cancer that is related to the BRCA mutation. You can do things to mitigate that risk. So whenever we get into a car, to mitigate the risk of a car accident, we wear our seatbelt, we obey traffic laws, we drive the speed limit, we use our blinkers, we pay attention, we do all these things, right? This is the same thing whenever you have a BRCA mutation, male or female. If you've got that mutation, if it's in your family line, even if you don't want to get tested for it, if you think it's in your family line, then the way you mitigate those risks associated with that is you do things to lower your risk of getting cancers overall. Again, diet, lifestyle, exercise, antioxidants, supportive, good, healthy lifestyle decisions, all of those things go into that. So if you want more information on that, we can certainly help family members as well. But in this study that I want to look at is in 2022, the BRCA mutation in ovarian and prostate cancer, right? So what this was looking at is this is saying that tumors with BRCA1 or BRCA2 mutations are highly sensitive to PARP inhibitors. PARP inhibitors is a class of drugs that is a targeted therapy out there for the oncology community, and it works very well if you have a PARP mutation. And if you have a PARP mutation, especially with the BRCA1 or BRCA2, they are highly sensitive to the PARP inhibitors. And whenever we look at that BRCA mutation in the context of familial kind of passing down through, we look at what stage the cancers are diagnosed at and how aggressive they can be. So a lot of times, depending on the genetics of the cancer, it will tell us how aggressive it is, how much it likes to grow, how fast it likes to grow, where does it like to metastasize to. And depending on all of those parameters, we can use effective therapies and really target some of those genetics. We do that through genetic testing of the cancer directly through the tumor by getting a sample of biopsy, also looking at liquid biopsy, so through the blood, and those are specific tests that we have access to right here in the United States, right in your own backyard, CLIA approved lab. It's a fantastic lab. And you need to have these genetics tested because let's just say you have a PARP mutation and you take a PARP inhibitor. This is going to be very targeted, and we want to make sure though that as the cancer cell mutates that we're watching those genetics, because there is a need for the biomarker predictability of what is changing. So as those receptors change, as the genetics of that cancer change, which they do all the time, they can change their genetics in 1 to 2 months after you start a therapy. It's part of the reason why therapies don't work continuously, because as the cancer cell is starting to be killed by that targeted therapy, it's going to downregulate those receptors, it's going to downregulate those genes, and it's going to upregulate something else, which isn't kind of interfered with by those inhibitors. We always have to change them. So what I'm saying here is whether you have ovarian, whether you have prostate, whatever disease location you have, because again, remember, cancer is not necessarily a geographic disease anymore. It's a genetic disease that is ever changing. It is a moving target all the time. So if you have a BRCA mutation, it's one of those things that we want to look at, and it's one of those things that we want to monitor and follow all the time. Our patients are getting tested approximately every 1 to 2 months for looking at those genetic mutations so we can stay ahead of that changing cancer cell. Whenever it changes its targets, we're going to change our targets, because the idea is to be ahead of it so we can constantly nail it and constantly be on the right trajectory to always be targeting that cancer cell to the time that we have no evidence of disease. If you'd like to learn more about how we can do this, the testing that we do, and the therapies that we can help guide you through, and also supportive structures that we can give you during all of those targeted therapies, please fill out the form below and we'll be more than happy to tell you about those.